Hello, my name is Denise. I am a nurse and diabetes educator with Allied Services Home Health Department here in Clark Summit, Pennsylvania. And one Wednesday of the month from 10 a.m. to 12 noon, we present a diabetes education class to the community. So this is a class that is free to the public, and it's held here at the patient dining room at John Hines in Wilkes-Barre. Last class we had, I promised I would bring in information about the 3 stages of hypoglycemia or low blood sugar. So it's not that we just have, like, say, a 70 blood sugar and we feel shaky or sweaty. That's not where low blood sugar stops. We have 3 different levels of low blood sugar that you all need to be aware of and what happens with these 3 levels. So I'm going to pass out this again. There are 2 papers. We're going to pass them out. Leo can start to go together. So the first one, pass this one and go down, and then take one of these. And if you're 2 together, just share one.
Denise, I have a question about, I was checking my blood sugar last week one day, and I noticed that normally when you stick yourself, it's dark red.
It could be dark red or lighter.
It was a lighter red when I checked it was 176. Now would that being it was lighter, would that cause that to go up so high?
So what Leo is asking is, does the color of the blood affect the result of the blood sugar?
Yeah.
That's hard to say, because if you have an elevated hematocrit, it's part of a blood test that you can have done, it can change your sugar number. A high hematocrit could mean, for example, you might be a little dehydrated. When you're dehydrated, the blood sugar can be a little elevated. So it's possible.
Okay, it kind of shook me up because I never had one that high before. I thought it was because of the...
If you have a high blood sugar or you have a low blood sugar, you should always ask yourself, did I wash my hands before I checked the sugar?
That's all I always do.
If you don't wash your hands and you just get done eating a piece of fruit, like an orange, for example, there might be juice on your skin. You take your sugar and it's 300 because of the sugar on your skin. That's why we always say, wash your hands, before you check yourself. And if the numbers looks like too much out of the range of what you usually have, if it's too low or too high, check it again. Always check it twice if the number's kind of crazy and it's not, your usual numbers. All right.
Do it on the other hand.
You could do it. The most important thing being just a little soap and water, because you don't know. You pick up everything we touch, somebody else touched, and you don't know what can affect the result.
Does the heat of the water have any effect on the...
It'll make the heat of the water, if it's warm, not hot, it will make your circulation really good so that you'll have not a lot of nice redness to your fingertips. You go on the side of the finger, it stings less than right on the front, the pad part. So it's supposed to, the warm water is supposed to get the circulation going. You can even rub your hands, good, because you want enough of a droplet of blood. If you don't have enough of a droplet, you're not going to have an accurate result.
Hand sanitizers wouldn't be any good then, right?
They're good in a pinch, but if you're near soap and water, I'd rather soap and water. I don't know if, the fragrances they put in hand sanitizers would affect the sugar or not.
It says soap and water is even better than alcohol.
Yes. Sometimes when people use alcohol on their finger, they don't let it dry, so when they stick their finger, the alcohol is getting mixed in with the sample of blood. That could affect your results. Same thing if they're using a syringe and they're cleaning the area with alcohol and they're putting the syringe in. If that's not dry, you're taking alcohol into the skin with that injection of insulin, and you will feel burning and stinging from that alcohol. Truth be told, you can actually give yourself an insulin injection right through your clothes. People do it all the time. It is a safe thing to do if you don't have a big heavy jacket and you have something light. people are often seen, administering insulin to themselves. If they're out to dinner, they want to be discreet, they can actually, go through their shirt and give themselves the insulin. And that's perfectly fine to do that. Okay, 3 stages of hypoglycemia. Hypoglycemia is the term we use for low blood sugar. So, the first stage is when a person might feel a little bit of shaking, a little sweaty, and a little hunger. The treatment. If you have glucose tablets, which can be purchased very inexpensively at the pharmacy, maybe they cost $2, and you have a nice stack of them in a little container.
How long do they last before they...
There should be an expiration date on the back, but you would need 3 of those sugar tablets, not 1. 3 to equivalent 1 slice of bread or 15 grams of a carbohydrate. So you would treat yourself. If you're in a kitchen and you're feeling low, you can take 8 ounces of milk and a few crackers or a slice of toast. So this is the treatment. If you're a runner and you're out on your path to running and you start feeling low, you better have a little backpack on yourself and your blood sugar meter to check your sugar while you're running. And we all see the runners do this, and have a snack bar, a cereal bar or a protein bar that has 15 to 30 grams of carbohydrate content. You'll always find how much carbohydrate is in the food when you look at 2 words on the package: total carbohydrate. Total carbohydrate. Don't look at the word sugar, don't look at the word sugar alcohol, because those are incorporated, the sugars are incorporated into the words total carbohydrate. So 1 serving is 15 grams, like a slice of bread. 2 is 30 grams, like 2 slices of bread. So when you see numbers, here's a cereal box that has 45 grams of total carb in a cup of cereal. You'll know that that's 15, 15, 15. That's like 3 servings. So if you're really crazy about that cereal, that pretty much, is what you're going to be eating for breakfast. If it's got 45 grams of carb with your milk, that's, you don't want to go having, a big, lots of toast and, a big breakfast when you're eating a cereal with that much carbohydrate content in it. Okay, so here, we'll take Mary, for example. Say we have a fictitious character called Mary. She feels shaky and sweaty. She says, I might be having a low blood sugar reaction. She checks her sugar, and it's maybe 70. Okay, maybe it's 70. With that, she has a half of a peanut butter and jelly sandwich and a glass of milk. After you take that snack, 15 minutes later, you should be checking that sugar again to make sure you're up over 80. So she waits 15 minutes, she checks it, she's 86. She's good until the next meal. If she's near lunchtime, she might want to just have her lunch and then still take that sugar 15 minutes after lunch. Okay, well, later on in the day, Mary decides to go for a walk. Her doctor did a stress test. She was good to go. There wasn't like heart issues or problems. So before she went for the walk, she checked her blood sugar, and it was 80. So she said, I better have a snack. So again, she had her half of a sandwich and a glass of milk, and she went on her walk. Well, it was such a beautiful day. She lost track of time, and she lost track of distance. So instead of that 2-block walk she wanted to go take, she just kept going, and she might have went 8 blocks. But Mary had to realize that you go out 8 blocks, you got to come back 8 blocks. So that's a lot of walking. That's a lot of your body using a lot of energy. And so she started feeling rapid heartbeat. She started having a headache. She started feeling like agitated. She had her blood sugar meter with her. She took her blood sugar, and it was 60. So she said, I took my snack, but I need another snack. So in her backpack, she was smart, she had pulled out another snack. 2 cereal bars, a little bit of juice, and then she continued. She sat a little bit to rest. Then she felt better, get up, and she walked some more. So she's heading home. Well, she maybe it was 4 blocks from her house, and she just got really, really weak. She did not know what to do. She knew she was weak. She knew she had to get home. She was close to her home, and she was in the neighborhood where she lives, and she sat on a bench at a little park by her house, and she just couldn't get up to walk. She felt so weak that she passed out. So with that, someone saw her, called 911. They came, they took her blood sugar. She was 40. So right away, they gave her a shot of glucagon. Well, they'll put an intravenous in her. They'll give her some dextrose water, which is like sugar water, to make it simple. And if she had a family member with her that was on this walk, the family member might have prepared what's called glucagon injection. Glucagon is not insulin. Glucagon is a hormone that's produced in another part of your pancreas. So your pancreas doesn't just produce insulin for use, it also produces other hormones that the body uses. Glucagon is in another part. Glucagon makes the sugar come up within 15 minutes. So where insulin makes the sugar go down, glucagon brings it up. And usually when people are insulin dependent, they use insulin, the doctor will write them out a prescription for glucagon kit. So they take it to the pharmacy gives them the glucagon kit, and they can keep that kit for 5 years. Every 5 years they get a new kit if they don't use it. But if you had to use it, say she had a family member with her, before the family member called 911, the family is pulling up a diluent or a solution in one little bottle, and they're taking it and putting it into a little powdered vial in another bottle, and then they mix it up. They shake it good till it's all clear and dissolved, and then they use an insulin syringe to pull it up, and then you give it, and the tummy is the quickest acting. And in 15 minutes, that sugar should come right up. That's the beauty of having glucagon, if you mostly for insulin-dependent diabetics. But she came around after she got her intravenous sugar, water, dextrose, and water. She became alert, but she wasn't alert enough to swallow any food. She was alert, but she was a little groggy. So at that point, she wasn't going to be given anything to eat. So when they get her to the hospital, they, give her her dextrose until the blood sugar comes up to, say, 80, where she's alert and she's able to swallow with no problem. What you never ever want to do is give someone whose sugar has dropped and they're groggy. You don't want to start feeding them food because they'll choke. The stores have a gel, a sugar gel, or glucose gel that comes in a pack that if you're with someone that's not out of the picture yet, but they need some kind of sugar source to bring the sugar up, while you call 911, you can squeeze into their mouth sugar gel, glucose gel, or cake icing that comes in those little tubes. You squeeze it on the inside here, it just dissolves and goes down slow, and they don't choke. That's another way of bringing the sugar up. So, there we have our 3 levels of low blood sugar. Question. Yes.
Question, guy.
That's okay.
What if somebody feigned it like this, and some individual came along and thought they had a heart attack and started giving them CPR? Do you recommend the bracelet?
Very good question. Very, very good question.
Hinder their, recovery?
It could. When you see someone lying on the ground, you don't know what's happened. You don't know if it's, they used alcohol and they passed out. You don't know if they had a heart attack, a stroke, or a diabetes crisis. You have your phone, 911. You don't move the patient or the person. You let them in the air, how they are on the ground. What are you going to do? You can't give them anything because you have no history on the person. You just stay with them and call 911, and the paramedics will come and assess the patient and do what they need to do. That's a really good question.
How about the wristbands?
Very important.
Pretty good.
Does anyone here have either a card in their wallet that states they have diabetes or other form of identification? Yes?
I have a card in my wallet.
That's wonderful. Everybody should have a card in their wallet, or a bracelet, or a necklace, or a charm that goes on the watch. There's many kinds, very good, of identification. You'll get help a lot quicker, and there's just less time wasted when they know you have diabetes.
Because sometimes somebody, if they find you like that, they might be reluctant to go into your wallet.
Yes.
Go in somebody's wallet, You know, you think you're robbing them, so
Right.
a wristband or a little thing, and okay.
Lots of people put a list of their medications in their wallet along with the identification card because it's just great for the hospital to see, oh, you know, they're on this, 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 and this. You know, and they could see if you're on insulin or diabetes medication or heart medication that you need. And that's really important, identification and a list of your medications. How many of you give a list of your medication to every doctor you see? Okay. Okay. And what's the problem if every doctor you have doesn't have a list of your medications? They could duplicate your medication and give you prescribe a drug with a generic name that you may not be familiar with. They need to know because you know there's always a high risk for error if that doctor doesn't know every medication you're taking, even the ones over the counter.
I have mine all in one card.
Look at you, very good. You're always so organized. She's always organized. She has lists for
My
everything.
daughter doing it for me too.
That's
I can't
wonderful.
remember them all. That's the trouble.
Oh no, they ask me, I'll say here.
Yeah.
That's all.
Denise, I assume too that your druggist will have a list of them too, right?
Yes, your
So-
druggist can make out print out a list for you to carry with you. You can make copies of that. And your druggist has a list of all those side effects, adverse effects. There's some medications you shouldn't mix with things. You shouldn't drink, for example, grapefruit juice with heart medications. It has something to do with absorption. You know, you shouldn't use antacids within 2 hours of some medications. Oops, excuse me. I think that might be our speaker.
Okay, first of all, I'd like to thank you guys for having me. As she said, my name is Lori Knight, and I work for a company called Sigvaris, which is a compression stocking company. So before I start, I just wanted to ask any of you, is anybody familiar with compression stockings? Does anybody wear compression socks? You do? Right. So then once you started wearing them, did you notice any difference in your
I
legs?
do feel great, but then I don't work anymore.
But you can still wear them.
Yes, I do.
Okay. All right. Well, that's good, and thanks for the input. But that's actually what I wanted to talk to you all about. There are compression socks out there, but Sigvaris has the only diabetic compression sock, and the difference between our compression sock versus any other diabetic sock that's out there is they're all cushioned at the toe and the heel, which is great. It makes it comfortable for you. They all feel soft. In fact, I'm going to pass it around so you can feel it.
Yeah, wow.
Yeah, they are. They're very nice, but they all feel nice. But the difference between Sigvaris' sock and a different compression sock out there is this one is the only one out there that has graduated compression. And what that means is, has anybody ever had surgery where post-op they're laying in bed and they put those SCDs on your calf and they blow it up? And do you guys know what I'm talking about? Well, right, that's sequential compression. So what the compression socks do is simulate that, because what that's helping to do is increase your circulation. So that's what the diabetic compression sock does. There's more compression at the ankle than as it goes up. So what it's doing is simulating that pump by increasing your circulation, sending your blood back up to your heart quicker, and that's what makes your legs feel better when you do actually wear them. And why it's important for diabetic patients to wear socks, if their doctor tells them to, is, does anybody have swelling in their feet, their ankles, their calves? Do any of you guys? Okay. Well, that's what it will help eliminate. It will not only make your legs feel better, but medically, it will take away the edema or the swelling that's in your calf or your ankles or your feet, which in turn will make you feel more comfortable, make you feel better. And that's the reason for the compression, and that's what it actually does. So, again, it is seamless. It's padded at the toe and the heel, and it's an easier sock to put on than a lot of them. Do you find them difficult to put on? No. You're good with putting them on?
Oh, yeah.
Your level of compression might be lower, so that's good. If your doctors ask, if you tell your doctor about this sock and you're interested in wearing it, for their information, the level of compression in the sock is 18 to 25 millimeters of mercury of compression. And it's in that little blue pamphlet that I passed around, just so they know. It only comes in white, doesn't come in black, comes in white only in case if there's a wound or if there's any type of drainage from the wound, you'll be able to see it, your doctor will be able to see it. That's really it. And then, I also passed you guys around a foot cream. It's not only a diabetic foot cream. I use it all the time, and not only on my feet, on my hands, my elbows. It's just a great dry skin cream. I don't know if anybody needs that, is interested in it, but I just wanted you to be aware of it. So I wanted you to see that. I'm going to just pass this around because these are all just different fabrics that Sigvaris offers in the different socks. And again, the socks are all offered in different levels of compression. The lowest level of compression is 15 to 20, which is what you might be wearing since you're saying it's not a difficult product to put on. But then the next level is the 18 to 25, the diabetic sock, and then it goes higher, 20 to 30 and even higher than that. But I just want to pass this around because I know most people think compression stockings are still your grandmother's ugly old stockings, and they're not. They've come a long way. They're patterned now. There's colors. There's different fabrics. We have sports socks. So I just wanted to let you guys see what's out there. I'm sure you're all going to want these. These are our sports socks. Anybody interested in our... Right, exactly. So these are for the athletes of the group, but these are footless, and I just wanted you all to see, how far they have come and that they're not so hideous.
Very warm, are they?
These are not. These are new merino wool ones. I wore these for every one of my son's football games this past season, and you're right, they were very warm. If you want to pass these around, yeah, but they're nice. They actually aren't itchy, and they come in calf length, thigh length, or pantyhose. These are our newest. I'm sure you gentlemen are going to love these. Yeah, well, that's just a figure of speech till I get to know them. But they're patterned. These are our thigh highs and pantyhose, different colors. So I just wanted you guys all to be aware of what's out there and the difference between Sigvaris's graduated compression diabetic sock versus just a diabetic sock. Does anybody have any questions?
How can we order these stockings?
Good question. Sigvaris does not sell to CVS, Walgreens, Rite Aid, any of those chain pharmacies. And the reason is you need to be measured. It's a medical sock. It's not just any type of sock. You need to be in the right level of compression if you're not choosing just directly the diabetic compression sock. You could be in the 15 to 20. You could be in the 20 to 30. If you're getting a 20 to 30, you need a prescription from your doctor. And you need to be measured because there's 6 to 8 different sizes. And you don't want to go to one of those chain pharmacies and you're on the shelf trying to figure out yourself what size you think you should be in. Your doctor needs to measure you. Or if you go to one of the dealers or DME dealers that sell Sigvaris, they've been certified to fit you, and they'll be able to tell you what size you should be in. This area is very new to me, so unfortunately I don't even know where to tell you to get them off the top of my head, but I can let her know once I know. But this is the second time I've been out here. Yes, I'm going to give it to you. Or leave them here? Oh, yeah, okay. Does anybody know of other than a Walgreens that's around here?
How about the diabetic shoe stores?
You know what? Yes, they're a great source.
You know one, the one in Marshall's Creek. The diabetic shoe store they advertise?
See, I don't know. I literally, the second time I've been here.
Shoes from,
Serpio?
no, from
Okay, I thought maybe
my
they
drugstore.
Oh, okay.
From
Is there a diabetic shoe store?
Absolutely, and they typically could or would or should carry them as well, but not everybody does. But I think if a lot of patients went to one of those places or a non-chain store and asked them to carry the product, they would, but they would just want to know that, of course they're going to get business from it. So,
When you put those on, what are they supposed to be, like snug?
yeah, they are. Oh, and I'm glad you asked me that. They are definitely supposed to be snug. In fact, I have boots on, but I'm wearing them now. I mean, you can see I wear them every day. I mean, they're,
Yeah, all right.
you know, you'd never know I'm wearing
Yeah.
compression
No,
socks.
no, you wouldn't know.
No.
Because I have some supposedly diabetic socks at home, and I never wear them. They're awful loose.
Oh,
Them baggy
if
things.
they're too loose, they're not working.
Yeah, that's right.
Because they need to, that's why you need to be fitted. If they're too tight, it's not good, and if it's too loose, it's not good. But too loose is actually even worse than too tight because it's not, this is what it should be doing,
Okay.
is
Oh, I
feeling
see.
like,
Yeah.
I mean, you're not going to actively feel like somebody's hands are on you doing that, but that's what it's simulating, is the pump of helping your blood
Exactly, yeah.
flow back up
Come
to your
back up,
heart.
sure.
Yes. And if you do put them on, if you do get them and you do put them on, the biggest complaint with compression is they're difficult to get on because they are tight. So don't put them on this way. Don't put them on the way you'd put a normal sock on, because that's like if you take your hands and you have one rubber band on your hands and you do that, it's easy. But put 10 on, and it becomes very difficult. And when you do this, it's like the rubber band effect. The compression accumulates and makes it very difficult to put on. So the best thing to do is to fold the sock in half, like that,
Yeah, I would've never
and
thought.
then you slip it on.
Exactly.
Try to do it as quickly, you know, in one swoop motion, and then work it up with your hands.
Yeah, that's. I was
So-
wondering how you were going to do it.
Yeah, that's how.
How about that?
So,
See there, you learn something new every day.
Yeah, yeah.
and now to show you my little toy, because the biggest complaint with compression is putting them on. This is Sigvaris's Doff and Donner. It helps don the stocking on, you know, either you as the patient or a caregiver, or, you know, in the vein centers after a procedure, the doctors and nurses will use this. So what happens is this suctions down to the table so it doesn't move, and then you just take the sock, whether it's a knee high or a thigh high, and it goes right over the top of this. This weird thing is full of soap and water. Just goes right over the top here. And then all you do is pull this out and up just a little bit. So this is not the leg. Everybody thinks this is the leg. This is not the leg. So then this goes up over here. Now my hand is my foot and my arm is my leg. So the foot goes into this and it just slides right on.
Out of here. Wow.
Yeah, so it's a very strange looking device, but it's the best donning device I've ever seen, because it really is the truest number one complaint of compression is putting them on. So, yeah, it is.
Whoever thought of that.
I know. Try walking around with that thing. So, anyway, thank you all.